Very good morning. Today is 1st April. So 1st April is celebrated as April Fool Day. आप में से किसी को पता है कि आज क्या इम्पोर्टेंट चीज़ है? इसके अलावा प्रिवेंशन ऑफ ब्लाइंडनेस वीक स्टार्ट फ्रॉम टुडे टू 7th April. So this was celebrated by Pandit Jawaharlal Nehru and Rajkumari Amrit Kaur. So this year the theme of Prevention of Blindness Week is Uniting for Glaucoma Free World या Glaucoma Free India. So आज से Prevention of Blindness Week भी start है, which will continue till 7th April. So first of all, I welcome Dr. S.K. Gupta sir, who came from after 2 weeks vacation from पुणे. मैं डॉक्टर निपुण से रिक्वेस्ट करूंगा कि डॉक्टर गुप्ता सर का स्वागत करें जोरदार तालियों के साथ. बहुत बहुत बधाई, बहुत बहुत शुभकामनाएं. एंड टुडे वी हैव टू स्पेशल फेलोज विद अस, डॉक्टर योगेश मंगुलिया फ्रॉम सूरत. सो वेलकम डॉक्टर योगेश. I would like to request Arun Gautam ji to welcome Dr. Yogesh Mangukiya who came from Surat. जोरदार तालियों के साथ डॉक्टर योगेश का स्वागत, अभिनंदन. एंड टुडे वी हैव अनदर स्पेशल गेस्ट, रेटिना फेलो फ्रॉम एडलाइड ऑस्ट्रेलिया, डॉक्टर साई लक्ष्मी सुवर्णा येलुगुरी. So welcome Dr. Sai Lakshmi, and I would like to request Dr. Roshni ji to please welcome Dr. Sai Lakshmi Suvarna Yelguri. So this is very good name and it explains a lot of good message for everybody. So let me analyze the 4 words of her name. Sai यानी God Almighty. साई इतना दीजिए जामे कुटुम समाए, मैं भी भूखा ना रहूं साधुन भूखा जाए. लक्ष्मी यानी द गॉडेस ऑफ वेल्थ, राइट. एंड सुवर्णा यानी कि जिसका वर्ड जो अच्छा हो, मतलब सुवर्णा and then am I correct? Okay. So and last but not the least, I would like to request Devraj ji to welcome Dr. Nipun. Praveen ji please join. Devraj join कर लो. To welcome Dr. Nipun who has trained more than 25 fellows. So 27, अब इनको मिला के 27. जोरदार तालियों के साथ डॉक्टर निपुण का स्वागत, अभिनंदन. So I would like to request Dr. Gupta sir to deliver the welcome address.
हरिद्वार से लेके आए तो उनके लिए भी थोड़ा स्वागत करना जरूरी है.
Thank you sir. Thank you.
Good morning to all. I welcome both fellows on the basis of on behalf of SuVi Eye Hospital. I think they will learn a lot from our esteemed Dr. Nipun. He is a well-known figure in medical retina, glaucoma and uvea. And he is also an author of medical and many motivational books. You will learn a lot which will be useful in your future. Thank you.
Thank you sir. Thank you very much. Now I would like to request Dr. Nipun sir to come and introduce Dr. Suvarna and share about their journey.
Good morning and welcome Dr. Suvarna and Dr. Yogesh to join as a Medical Retina Fellow. We warmly welcome you. And just a brief orientation program so as to what we will learn in this fellowship. So we started this fellowship in Medical Retina and Uvea from September 2023. So we saw many interesting medical retina and uvea cases and regarding the fellowship. So just a brief introduction about Dr. Sai Lakshmi Suvarna. She has done observership from Royal Hospital, Adelaide in South Australia, and she has a diploma in ophthalmology from Andhra Pradesh and DMD from Shankara Eye Hospital, Coimbatore. And she was a consultant ophthalmologist and phacosurgeon in Haima Netralayam, Andhra Pradesh, and she did her clinical observership at the prestigious Royal Adelaide Hospital in Australia, and she participated in various academic meetings and observed many outpatient ophthalmologic clinics and theatre sessions. And she was a senior house officer plus a secondary DNP training in both the academic as well as the operation theatre in the cataract surgery as well as the diligent surgery. And she was a junior consultant at Vasan Eye Care Hospital for a brief period in Coimbatore, and also at Sai Sudha Multispeciality Hospital, Kakinada. And she has many various professions. She is a very excellent phaco surgeon, cataract surgeon, and also an oculoplasty. She does DCR very well. And so that's about her. And she has many research and publications to her credit. And she is a member of All India Ophthalmological and even Andhra Pradesh Ophthalmological Society member. Her clinical interest lies in medical retina, glaucoma, cataract surgery, and oculoplasty. So, and regarding Dr. Yogesh Mangukiya, he is hailing from Surat, Gujarat, and he was a consultant ophthalmologist at PP Mania Hospital, and worked as a junior consultant at Mishri Devi Eye Hospital, Rajasthan also. And he is also an excellent phaco and refractive surgeon, and has done many pterygium excision with conjunctival autograph. And he has many publications to her credit also. So, what are the objectives of this fellowship? My main aim of this fellowship is to diagnose and treat the medical retina and uvea conditions, and to counsel the patient properly without a minimum number of investigations. So, first and foremost is the slit lamp biomicroscopy by 90D and indirect ophthalmoscopy with scleral depression, so that we can see the peripheral retinal lesions such as the lattice degeneration, lattice with holes, horseshoe tears, retinal holes, and we can counsel the patient properly and appropriately laser them as and when required. So we will see many cases of peripheral retinal degeneration such as horseshoe tears, retinal holes, lattice with holes, and cobblestone degenerations. And even India is now the diabetic capital of the world, so day in and day out we see many cases of diabetic retinopathy, all stages, mild, moderate, severe PDR. Yesterday only we saw a young patient with proliferative diabetic retinopathy with vitreous hemorrhage. We'll do a PRP today also. And not only diabetic retinopathy, hypertensive retinopathy, vein occlusions, and central retinal vein occlusion and branch retinal vein occlusions. And the age-related macular degeneration, we see day in and day out many cases of age-related macular degeneration. Prevalence is increasing. So the OCT interpretation is very important in these cases. So we learn how to interpret the OCT, where is the fluid, what is the prognosis, what are the OCT biomarkers, and how to counsel the patient regarding the prognosis and the number of injections. Because patients in private, they keep on asking how many injections will you give, till what time the treatment will continue. So these all practical aspects we will discuss, the OCT interpretation and how to counsel the patient. And the pachychloride spectrum, we are seeing many cases of CSR considering the amount of stress and steroid use. So we are seeing many cases of CSR also. So how to counsel them and when to inject, inject anti-VEGF in them, and when to observe. So these all practical aspects we will discuss in them. And we'll also see cases of hereditary, retinal dystrophy and also macular dystrophy, and how to counsel and treat them appropriately. Not only medical retina, we are seeing cases of neuroophthalm also, such as optic neuritis, neuroretinitis, ischemic optic neuropathies also, and retrobulbar neuritis also. And regarding surgical retina, we are seeing cases of retinal detachment, full thickness macular hole, thick epiretinal membrane, and non-resolving vitreous hemorrhage, and how to counsel them regarding surgery and when to consider them for the surgical intervention. And regarding uveitis, we will see many cases of anterior granulomatous and non-granulomatous uveitis, and even the posterior uveitis such as toxoplasmosis, multifocal choroiditis, retinal vasculitis, and this was an interesting case of serpiginous like choroiditis. And regarding imaging modalities, we are blessed to have OptoView OCT and quantal B scan, the OCT interpretation, fundus fluorescein angiography interpretation, B scan interpretation in hazy media where there is dense cataract or the media is hazy, to differentiate retinal detachment from PVD, to differentiate vitritis from vitreous hemorrhage, and we'll see many conditions on the B scan. And regarding hands-on training, we'll give intravitreal all kinds of anti-VEGF injections such as bevacizumab, aflibercept, ranibizumab, brolucizumab, and intravitreal dexamethasone implants such as Ozurdex and triamcinolone, and the posterior subtenon injections. And so these are some of the videos which are fellows giving intravitreal injections. Dr. Suvarna, Dr. Gagan was there with us in Coimbatore. So he was giving intravitreal ranibizumab injection. So this was given under supervision. So we will be doing hands-on laser machine, laser on the AEON multi-spot laser slit lamp, both the PRP as well as the barrage laser on the slit lamp as well as on the LIU. These are some of the fellows doing LIU on the AEON multi-spot slit lamp laser machine. So when to laser, how to focus, what are the power, duration, interval, how to at what settings to keep depending on the media opacity. So we'll get to discuss all of these practically. Not only that, we'll have some academic discussions in this very hall, the academic discussions regarding the OCT, B-scan and the interesting cases, and we will get to present the interesting case presentations, and you'll maintain a logbook as well regarding interesting medical retina and uvea cases. And till date we are in touch with our previous and upcoming fellows also when we discuss interesting medical retina and uvea cases and findings. And for their help, me with the help of sir and under the mentorship of sir, I have authored many interesting medical retina and uvea books for the reference. So these are the medical retina and uvea books. There are 3 volumes. So these are all available on Amazon Kindle also. And we got a chance to launch our book at the prestigious All India Ophthalmology Conference in Jaipur. So thank you to Dr. Suresh Pandey sir, Vidushi ma'am, Dr. S. K. Gupta sir and Dr. Abhishek Kothari sir, without the help of this fellowship was not possible. And thanks to my alumni, SuVi Eye Foundation, Bharatiya Vidyapeeth University, Arvind Eye Care System and Shankar Nethralaya. And last but not the least, आप सबको बहुत बहुत धन्यवाद. Thank you to all the team SuVi Eye family for the support आप लोगों ने जो दिया, जिसके बिना ये fellowship journey was not possible. Thank you, and I hope our short journey will be inspiring, challenging, and satisfying and rewarding.
Thank you so much, Dr. Nipun, for the excellent presentation, and congratulations once again for inspiring 25 fellows and motivating them to do and to excel in their work. So जैसा कि हमें पता है कि भारत डायबिटीज की राजधानी बनने जा रहा है. भारत में 10 करोड़ से अधिक व्यक्ति डायबिटीज से पीड़ित हैं एंड 13 करोड़ लोग प्री डायबिटिक हैं, क्योंकि डायबिटीज जिनको होने की संभावना है. So actually this is a very serious health problem, so we need to be trained and well equipped to treat the complications of diabetes, which are diabetic retinopathy, and there are other complications also like diabetic nephropathy, diabetic neuropathy, sudden cardiac arrest, and etc. etc. Now I would like to invite Dr. Yogesh to share his journey to come from Surat to Kota. Dr. Yogesh, please come and share your journey.
Good morning everyone. First of all, thank you sir for this welcome. Basically I have done my MBBS from China, then I have completed my DNB from New Delhi from Sant Parmanand Hospital. Then I have worked as a SR and consultant at Mishri Devi Eye Hospital, Alwar. Then I have joined the multi-speciality hospital, PP Mania Hospital in Surat. Currently I am working as a cataract and refractive surgeon over there. Thank you, sir.
Now I would like to invite Dr. Suvarna to share her journey to come to Kota.
Good morning everyone. Thank you for this opportunity. And my journey, I did my med school from Andhra and later my post-graduation from Andhra and Tamil Nadu as well. And worked as a consultant in Andhra and later moved to Adelaide where I got an opportunity to observe in one of the prestigious institute, Royal Adelaide Hospital. And due to my senior and colleague Dr. Nipun sir, I know about this and I know that I can learn much from them, and because of this prestigious staff and doctors, everything, I wish I'll have a good journey here. Thank you so much.
Thank you very much, Dr. Suvarna. Now, I would like to request Dr. Gupta sir and Dr. Nipun sir to present the books to Dr. Suvarna and Dr. Yogesh, and then we will have group photograph.
इंडिया डायबिटिक कैपिटल बनने वाला है और हम डेली डायबिटिक रेटिनोपैथी, एज रिलेटेड मैक्यूलर डिजेनरेशन के जो केसेस देख रहे हैं, इवन वेन ऑक्लूजन के केसेस देख रहे हैं, तो उनमें हमने जो एंटी वेजेफ इंजेक्शंस हम लोग लगाते हैं, सो उनका बेसिकली जो रेटिनल ब्लड फ्लो जो होता है वो कॉम्प्रोमाइज्ड होता है, तो उसके कारण ऑक्सीजन लेवल कम होता है जिसे हम हाइपोक्सिया बोलते हैं, और उसके कारण VEGF वैस्कुलर एंडोथेलियल ग्रोथ फैक्टर वो बढ़ता है, जिसके कारण क्या होता है कि न्यू वेसल्स बनती हैं और न्यू वेसल्स बहुत फ्रेजाइल, दे आर वेरी फ्रेजाइल होती हैं, तो वो उनके लीकेज के कारण रेटिना में स्वेलिंग, सूजन और इंक्रीज परमेबिलिटी, मतलब ब्लड फ्लो जो हेमरेज है वो आ जाता है एंड स्वेलिंग भी बढ़ती है। तो उसको रोकने के लिए एंटी वेजेफ जो इंजेक्शंस हैं, तो वी कंपेयर द एंटी वेजेफ इंजेक्शंस, सो इन फैक्टर्स में हमने कंपेयर किया जैसे बाइंडिंग एफिनिटी, पोटेंसी, हाफ लाइफ। सो हमने पाया कि अमंग द वेरियस एंटी वेजेफ इंजेक्शन एफ्लिबेरासेप has the highest binding affinity, potency and half life is also of longest duration, 9.1 days. So as compared to data from the head-on studies, aflibercept has highest binding affinity, most potent, and decreases the inflammation, new vessels and retinal vascular leakage as compared to the other anti-VEGF, and इनकी safety and efficacy profile भी it is very good as compared to the other anti-VEGF agents. So these are the multiple targets, whereas other anti-VEGF agents केवल VEGF-A receptors and the newer anti-VEGF agents VEGF-A receptors and ANG2 receptor पे bind करते हैं. Aflibercept VEGF-A, VEGF-B, placental growth factor and galectin-1 receptor bind करते हैं, which is called as VEGF trap also. So binding on all these anti-VEGF receptors, इन्फ्लेमेशन और कम होता है एंड लीकेज एंड स्वेलिंग और भी कम होती है. सो द पोटेंसी ऑफ दिस एंटी-VEGF एजेंट इज़ वेरी गुड. So the broader spectrum inhibition such as VEGF-A, VEGF-B, placental growth factor with a unique structure design which helps to reduce inflammation and neovascularization. So and the real world data also shows that more than approximately after 2 years of the treatment, more than 6.6 letter visual acuity gain and the treatment injection burden is also reduced. So in patients with DME, even with the newer molecule, they have compared the various studies have compared the ranibizumab, aflibercept, brolucizumab and other anti-VEGF agents such as faricimab, that aflibercept is non-inferior to other anti-VEGF agents. So the superior molecular profile and dual VEGF trap, multiple binding to the receptors and extensive experience of various studies shows that aflibercept is potent, durable, and superior in controlling diabetic macular edema related to vein occlusions, and as well as in wet age-related macular degeneration. Thank you.